Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And this is really a very special show because, to tell you the truth, folks, I'm going to ask you to allow me to present a subject matter that I think is very important. I can tell you, I don't want to personalize it, but it is important to me, but I think it should be very important to you. And it relates to items that are in the realm of craniofacial anomalies, birth anomalies, craniofacial surgery, and we're going to explain to you what that's all about. And the way I'm going to explain it is by introducing the experts. Let me introduce to you an incredible physician, a board-certified plastic surgeon, but more importantly, a community certified, a human certified good person. How about that? I can say that. Dr. Eric Stelnicki. Welcome, Eric.
Thank you very much. I'm glad to be here.
It's great to have you here. We're so proud to have been part of the beginning of your existence in our community, and of course we didn't train you, but we had an opportunity to work with you, and we still do work with you on a daily basis, so we're so proud of it.
Thank you.
And then we have a young woman here with a little cranial kid with her. Ari Yuri Camargo, who is I believe you're an occupational therapist,
yes,
correct?
Yes, sir, I am.
I'm very proud. It's a wonderful profession.
Thank you.
Welcome to our show.
Thank you for having me.
Good. Dr. Stelnicki, what is craniofacial surgery?
Craniofacial surgery is a branch of plastic and reconstructive surgery that involves the reconstruction and restoration of facial form and skull form and function for primarily children, but it does extend to adults. Basically, anytime a child or adult has anything that affects their facial development, be it from a birth defect, trauma, tumors, that requires that multiple components of the face and facial skeleton have to be reconstructed, that's where the craniofacial surgeon comes in.
And this did come up, and the reason why we asked you to come in, because people wrote to us, we had a couple of inquiries about cleft palate. That's an example of a birth anomaly, and what has, and as I know of it, and I'm not overstating it, many times children are born with multiple or singular birth anomalies, everything from, eyes literally on the wrong side of the head, no nose, cleft palate, no ear. I mean, please help me out here.
Yeah, well, these kids can range everything from an isolated cleft palate, which is just basically a hole in the roof of the mouth, which sounds simple, but really is not, and I can elaborate on that, to very advanced things, such as their skull bones being fused together, something called craniosynostosis, where their skulls can't grow, and as a result, the brain can't grow, and the eyes bulge out of the head. Their upper face, their mid-face becomes pulled back because their skull is fused, and they can't bite their teeth together, so they end up with a pushed-in face. These kids may be missing ears, may have a jaw that's improperly developed and can't hear, can't chew, can't even suckle on their mother's breast in order to nurse. And they are presented with a whole host of problems that's more than skin deep, that involves the bone, that involves the teeth, that involves the ability to swallow, to speak, to smell, to hear, to see. And we have to, in our discipline, be able to synthesize all those problems into a surgical plan that allows each part of that facial skeleton to be reconstructed.
Well, and the reason that I wanted to just get right at it here is because, many times people will react to visual things, and say, oh my goodness, look at that poor child, et cetera, et cetera. But it isn't just the visual nature of what you see. It's the functionality, as you just explained. And the reason why we're so proud to be affiliated with you is because we know that our oral maxillofacial surgery team at the dental school is involved with you and
Right. Oh, absolutely.
and work with you in in surgical procedures and aftercare and things of that nature. So we're very proud of our affiliation with you.
Yeah. Well, and it's even beyond the oral maxillofacial team. We work very closely with the dental program, the pediatric dentistry,
Right.
the orthodontic program, the speech therapy program here. All at Nova are integral parts of this. And one example, for example, we'll just use a simple thing like lip and palate and why that's important. If you're born with a kid who has a cleft lip and palate, everyone sees the lip split on the outside. Almost everybody's seen a picture of some child, whether it's on an Operation Smile picture or some billboard somewhere asking for money to help these kids. But it's more than the split lip. That split will go through the gum line. These kids will have missing teeth, will go into the palate. These kids can't suckle. Their teeth are splayed apart. Their teeth are not properly aligned. They can't speak properly because when they go to speak, all the air comes out their nose because of this hole that they have there. And so the plastic surgeon alone can't fix all these things. The plastic surgeon can align the soft tissue, can add some bone there, but they need the pediatric dentist to be there and fix those missing or malaligned teeth. They need the orthodontist to be there to make sure everything lines up and that the face is growing properly. They need the speech therapist to teach the child how to swallow, because these kids can't swallow properly in infancy, and then later in life to teach them how to not speak with so much air coming through their nose. They need the pediatric dentist to help us before we even operate, fabricate various splints and molds to help bring the lip together even before surgery so there's less tension and better scarring. So it's this synthesis of minds and disciplines that really improve the quality of care for these kids, because we realize that one discipline alone isn't able to handle this.
Well, that's why we're so proud of not only the team that we have here, but also at Broward Health with our oral maxillofacial surgeons, our pediodontists and our orthodontists, and all the other people, the occupational therapists, the speech therapists, the physical therapists. They're all involved, and actually we have a psychological services intervention as well.
Sure.
That we're very proud. We're very proud to be involved both with the South Broward Hospital District, namely dominantly the Joe DiMaggio Hospital, and at Broward Health, dominantly at Broward General. So we're very proud of that. May I call you Ari?
Of course, please do.
I have a middle son with a middle name Ari, as we discussed before the show. So
Yes.
I love the name Ari. So if you don't mind,
Thank you. Of course not.
tell me about your little cranial kid here.
My friend here.
Yes.
Really what she's wearing right now, I'm sure a lot of your viewers have seen out there in the community. It's a cranial remodeling orthosis. Is used particularly when patients have gone through surgery, and it's just to further the correction that the surgeon has so carefully done in the operating room. And also it is also used as protection, because sometimes in some of the procedures that they do, they need to remove bone that have been fused before its time. So it is used. It has a dual function. It works in protection to the brain while the bone grows and closes and can protect it, and also works in reshaping the head as the growth happens. Also, there are patients that are used with this type of device, not needing to have gone through surgery. Many children nowadays, since the Back to Sleep campaign, have been placed a lot of the time on their backs. And by doing that, the soft skull gets or adopts a shape that is either asymmetrical and causes that asymmetry to actually deform the face and to show that asymmetry throughout the skull. And these kids do not really require surgery to repair that misshapen shape. They can easily be treated